Hi, let's grab a CT scan from the queue, and before I lose my voice, let's just report a CT scan on camera. I have a CT scan here of a 91-year-old patient. This is a male patient, and it says he has difficult breathing and some kind of finding on a chest x-ray, and he also smoked or smokes to this day. I guess I have downloaded it. Did I download it? Yes, it's here already. Let me just share my screen. Yep, this is it. You guys can see what I see, and my throat is kinda sore. I might just lose my voice in a few moments. Yep, I'm just going to roll the images. This is a mediastinum window, and this is a lung window. I'm going to roll the images from up to down so you guys can look for pathology, and then we can follow up by describing the findings. Whatever you guys think is wrong with this patient, just leave in the comments below before we move forward so you guys can practice reading with no tips or pointers, which is quite nice for those of you who are still beginning this journey of learning CT scans. So, did you guys see anything? I have seen a few things, nothing major. I don't really think this patient has anything very much wrong with him. I clearly don't see any signs of emphysema nor a highly distorted lung disease, which we would expect from a patient that is a heavy smoker. We have some pulmonary bands and calcifications in both apex of the lungs. This is quite common. Also, another band with a tiny calcification right here on the apical posterior segment of the left superior lobe. One very important tip for such cases is you guys can readily see that this is a very well done CT scan. This patient is quite old, 91 years old, and there really aren't much breathing motion artifacts on this exam, so it means the patient isn't severely ill. So if he isn't a severely ill patient, we won't really find any severe disease, and so the exam has good quality. Usually the worst quality exams belong to the worst disease, the patient that are very sick. So I can see there is diffuse arthrosis, degenerative disease of both the spine and the shoulders, which we can say is very common on this age group. Let's do a sagittal view and confirm there aren't much. There is some increased kyphosis of the dorsal spine, which is degenerative in nature. osteophytes, the disc spaces are reduced, and yeah, no vertebral collapses, no nothing, just that plain old degenerative disease of the chest. Let's roll more parenchyma. So lungs right here. We have some bends on the right base of the lung, some thickening of the pleural leaflets on both bases. This is probably scar tissue from previous pneumonias. We usually also see that kind of finding on both inferior lingular segments and medium lobe, middle lobe segments, which we can see if we really look for them right here and right over there. So this is a quite normal exam. There are some calcifications on the aorta and of course calcification on coronary arteries, also on the aortic valve. There might be even some calcifications inside the left ventricle. We can't really tell because this isn't the exam to do that properly. Thyroid seems fine, a bit atrophic. Yeah, so this aorta tortuosity is quite common, not a serious disease. Also, we have to follow the esophagus, see if we don't have anything suspicious about the esophagus. It seems the esophagus is fine, quite fine. Pulmonary arteries and trunk are also fine. We have a bit of gynecomasty right here, some breast tissue right below the nipples, which is very common in the elderly due to reduced testosterone, chronically reduced testosterone, and sometimes chronic obesity. This patient isn't obese, so that might be due to old age. Nothing major is still. So there are some very tiny spots of emphysema which are very difficult to see unless you are actually looking for it. If you aren't really looking for emphysema, it's really difficult excuse me, to find it. I can't really report it as actual emphysema because this is very questionable. So let's just say there are bands and a few calcifications throughout both lung parenchymas, and we can go on with it. So let's start the reporting. I have a template for these cases, such cases. This is an elderly patient with a quite normal CT scan of the chest, and also the tortuosity of the aorta should report that. Atherosclerotic plates on the coronary arteries, and that is it. We are done here. And if you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click here and keep watching. Don't forget to hit that like button and subscribe to the channel, and I'll see you in the next video. So long.